health or medicine, we should use the term preventive medicine or preventive health. Now, preventive health or prevention is something which prevent things which have not yet happened. And that's why preventive health is always underrated or underestimated. Curative or treatment is something which gives an immediate result or instant results. That's why treatment is always overrated or overestimated. Now, when we talk about holistic health and you were talking about 5 pillars, it's important that as a society or as a community, we start thinking of giving equal weightage or giving a due weightage to the prevention, promotion, curative treatment, because all 3 are equal pillars. So I always talk and discuss that prevention, promotion, and prompt treatment are 3 pillars which should be given a due weightage. In fact, if we follow prevention, we can avoid a lot of disease burden. They think if I fall sick, I'll get treatment. But I think that is a wrong approach. We are living in an era where diabetes, hypertension, cholesterol disorders are rising. If we do not follow preventive approach, it will result in increased burden on hospital. It will increase the cost of healthcare. A healthy nation cannot happen only by the hospitals. It requires preventive approach, and that's why we need to pay more attention. I'll come back to other aspects later.
All right, Dr. Lahiriya, and yes, I mean, I think that old adage, prevention is better than the cure, has never been more true than, today. Ishi Khosla, we're talking about preventive care, and there have been campaigns around fitness, health, mental health as well. Do you think these are enough? Are they, getting the right, are they, they're targeting the young people? Are they getting that message across?
There is no dearth of information today.
Yes.
I think we as a generation are far more equipped with information, knowledge about food, about diet, about nutrition, compared to our parents, our grandparents, and our great-grandparents. There's so much conversation around food. There is so much information on when you buy food. There is it was never before. We have calories, proteins, carbohydrates, everything listed out there. We have equipment. When we're exercising, we have apps. We have everything today which was never there. But it's not adding up to good health. It is really, on the contrary, we are in a state of health crisis. And whether it's mental health, whether it's physical health, and the generations ahead. In fact, I'm going to quote from a Yale public health expert who has said the coming generation of children is going to have a shorter lifespan compared to their parents.
Which is so shocking because we'd expect the opposite.
It has never happened in the evolutionary history of mankind. So something is clearly not fitting in. That its information is not lacking, but we are probably not striking the right chords. And I'm also going to quote from Dr. Mark Hyman, who's a functional medicine expert. And he says, and I think that will sum it up very beautifully, that today we are being fed by a food industry which is not paying attention to health, and being treated by a health industry which is not paying attention to food.
So there is more awareness now regarding, what is going into you and what ingredients are in our products, but it needs to be more widespread. I think
it needs to be legislated.
Policy as well. We do know trans fats. There has been a lot of policy change, regarding that. But
using the right grains, using millets, using rice,
and we have the millet mission as well, pushed by the Prime Minister. Dr. Ashwini Setia, that brings me to you. We're talking about lifestyle diseases, and of course, Dr. Lahiriya, you would know about the ticking time bomb that is diabetes. That's another lifestyle disease that is increasing in the country as people are consuming more and more processed food. But tell us a bit about, taking from there to create awareness. We have, fatty liver that has nothing to do with alcohol. It's more to do with the kind of, products that are being consumed, as Ishi Khosla said. And there's also, environmental factors. There's a lot of plastics in our food right now as well.
As far as the community part is concerned, there is a paradigm shift in what the community health was there, say, around 40, 50 years ago and what it is today. Earlier on, we used to focus on clean, potable water, etc., because it was waterborne disease and vector-borne disease, etc. Now, the non-communicable diseases, that is the lifestyle diseases, also spreading in the rural areas, in our villages, because of the industry, because of so many other things. The industry is sponsoring so many things and advertising it so vociferously that the convenience foods are available there for everybody to pick up. And these convenience foods are playing havoc with our health. The inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, has paralleled the advent of fast food in this country. When I was doing my specialization about 45 years ago, at that time, we used to struggle to find one case of inflammatory bowel disease in the whole month or a whole year. Now, in every single month, we are having increased incidence of this. So that is because of the highly processed food. The high sucrose corn syrup is being used in cold drinks, and that is playing havoc with the health in terms of giving more sugar load. And you'll be surprised to know that fatty liver as such has got nothing much to do with the fat intake. It has got everything to do with the sugar intake. My own experience is that it is more than 80%. Right? So everybody is having that fatty liver. And what they do not understand is that this is an incidental detection because there are hardly any symptoms which will bring the patient to the doctor. And therefore, you are getting the ultrasound done for some other reason and you pick that fatty liver up. Problem is that it is insidiously progressive disease because it causes inflammation in the liver and then it kind of proceeds on to become fibrosis and cirrhosis, and further, in some cases, may also have hepatocellular carcinoma.
And people are landing up in hospital for this treatment, and you're saying this could be prevented had they taken care earlier, and we need to create that awareness regarding...
Not only that, so I would suggest that in case the message goes loud and clear that sugar must be avoided.
We're talking about messaging and getting that messaging right, and I'll come to you, Ishi. Tell us a bit about what corporates can do. What can we do at the school level? Reckitt has done so many, campaigns. They've been appreciated regarding, health and preventive health as well. So how can we get more corporates? What can we teach at the school level regarding this?
Thank you, Gargi, for having me here. And a beautiful partnership with NDTV from a decade almost now,
yes,
more than a decade.
One we're very proud of,
Yeah,
yes.
Thank you. So, first thing first is realizing India is a big country. And if you see just Uttar Pradesh as a state having the population equal to the population of the UK. So no fun working with 100 kids, 200 kids, 1,000 kids. We also started with 2,500 kids when we started our program a decade back. And now it's almost 30 million kids to whom we reach out to through our program just in India. Nudges are very important. And the power of partnership brokerage is very important. You need to get the right kind of people to work with. It's a mix of public health experts, a lot of decorated doctors, Padam Shris, Padam Vibhushans, and others. Equally, the school teachers. And the best part, what has happened is the change in the national curriculum framework and how the education policy is shaping up, especially in the schools. Now you have got the things what you can teach in the regional languages more. There is no compulsion to teach the messages in English. There's a big change CBSE has attempted now to talk about sugar in the schools. And very proudly saying we are one of the partners who will be taking the messaging, even we have no relationship with the sugar industry or something directly. But we talk about hygiene at home, hygiene in neighborhood, personal hygiene, hygiene during illness, oral hygiene, and a lot of other things what we teach.
And it's so important to teach children because they take these messages home as well. But thank you so much all for joining us today to talk about this very important issue, and it's an issue that NDTV will take further along with this campaign, India Health Mission. Thank you all, and a round of applause for the panelists.
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप करें @506 1820208663 पर या अपने रजिस्टर्ड मोबाइल नंबर से मिस कॉल करें 08068580506 पर।
देश का सबसे भरोसेमंद हिंदी न्यूज चैनल एनडीटीवी इंडिया देखिए डीडी फ्री डिश चैनल नंबर 55 पर।
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप कीजिए @506 नंबर है 1800208663 पर, या फिर अपने रजिस्टर्ड मोबाइल नंबर से मिस कॉल दीजिए 08068580506 पर।
अब हर खबर का होगा एक्सरे और दिखेगा अंदर का सच। देखिए एक्सरे रिपोर्ट सिर्फ एनडीटीवी इंडिया पर।
पहले म्यूजिक होती थी कि ताकि जरा सिंगर को आराम मिल जाए, अब सिंगर होता है कि म्यूजिक को थोड़ा आराम मिल जाए।
फेमिनिज्म का मतलब ही इक्वालिटी, क्योंकि अगर ये शब्द नहीं होता तो आज मैं यहाँ बैठी नहीं होती।
जैसा मैंने कहा कि राजा को रानी से प्यार हो गया, ये इम्तियाज अली की कहानियों में नहीं होता।
राजा को ड्राइवर की बेटी से प्यार होता है।
आपको कभी बुकर्स प्राइज या कोई इस तरह के अवार्ड की चाहत नहीं है?
एक वो ट्रम्प साहब को पीस प्राइज नहीं मिल रहा है, एक मुझे बुकर नहीं मिल रहा। एनडीटीवी एक जो इंटेलेक्चुअल ब्रांड था, उसकी जो कोर है वो अभी ऐसी ही सुरक्षित है जैसे सब ऐसे थी, ऐसी आपकी है।
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप कीजिए @5061800208663 पर, या अपने रजिस्टर्ड मोबाइल नंबर से मिस्ड कॉल दीजिए 08068580506 पर।
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप कीजिए @5061800208663 पर, या फिर अपने रजिस्टर्ड मोबाइल नंबर से मिस कॉल दीजिए 08068580506 पर।
हम खबर नहीं बनाते हैं, हम खबर नहीं बनाते हैं, हम वही रिपोर्ट करते हैं जिसमें कथ्य से ज्यादा तथ्य होते हैं, क्योंकि तथ्य ही मायने रखते हैं। हम जाते हैं खबरों की आखिरी परत तक। अगर एक भी आदमी की जिंदगी पर पड़े असर तो यही है खबरों की खबर।
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप करें @506 1800208663 पर, या अपने रजिस्टर्ड मोबाइल नंबर से मिस कॉल करें 08068580506 पर।
देश का सबसे भरोसेमंद हिंदी न्यूज चैनल एनडीटीवी इंडिया देखिए डीडी।
In a country as vast and diverse as India, true progress means making quality healthcare not just a privilege for a few, but also a right for all. From villages to slums, there are people in the country who still struggle to access affordable healthcare, but change is underway, and we have change makers here with us, with government schemes, innovations, and low-cost delivery and community health workers leading the charge. Today, we look at how India is working to ensure that healthcare reaches the last mile and leaves no one behind. We have with us Dr. Matthew Varghese, who is orthopedic surgeon, also known as the Polio Man of India, and we have Dr. Indu Bhushan, CEO of Ayushman Bharat, and we have Dr. Reji George of the Tribal Health Initiative, and we have Mr. Ankur Bharti, Executive Director, Grant Thornton, India. Thank you so much, all of you, for being here. Mr. Varghese, I know that you've worked in Delhi. While we talk about rural public healthcare and urban healthcare, there's a large portion of urban poor now, specifically in mega cities. How do you look at an affordable
public healthcare system for the urban poor who are living in megacities, and there are estimates that India will be urbanized more and more in the coming years. Do you have a model in your mind that should work very well, specifically when it comes to the poorest of poor people living in cities of the country?
Yes, indeed. It is a challenge because once the infant mortality rate goes down, then those children that survive, they will eventually need secondary, and eventually when they reach 70, they will need quaternary care also. Maybe a stroke, maybe cancer, maybe cardiac. Because eventually as a person grows older, he will need high-end care, will need arthroplasties also. So those are challenges. But the challenge there is, do we have to keep it healthcare as a profit-based or healthcare as an altruistic model? So the moment you bring healthcare as a profit-based model, then the biggest casualty that can come in, to my understanding, is ethics. Ethics. So can we provide ethical care from the private sector as well as from the government sector? So a lot of patients come to me asking for, Dr. Saab, do I need to have this surgery? Just a double check, is it really required? So that kind of a model of ethical care, whether the trust between the doctor and the patient becomes important, is a critical area. So therefore, patients are worried about whether this particular surgery is for profit or is it really indicated. Okay. So hospitals like mine, St. Stephen's Hospital, or for example, other hospitals that are there, which are working on this model where the patient is not viewed as a client to make more revenue, but patient is viewed as a person for whom service is provided for. So my hospital, 70% of the beds are general and 30% are private, and we do not have any profit being driven back to anybody else, not to the shareholders, not to the doctors. We are all on salaries, and that's a model which is workable. As director of the hospital, I could run any number of free patients, any number of those patients were taken care of without worrying. So subsidized care for the poor could come from the care in the same hospital from the wealthy patients that are coming and accessing very high-end care. Okay. So both are required. You need to develop the tertiary and quaternary care and high-end care to the rich being provided for while they subsidize for the care of the poor. It is a doable example. Okay, Doctor, but you need to look at, are we willing to do that or not?
Okay, Dr. George, I was looking at you have a wonderful story and we need to talk about it. You and your wife decided to be in a place where there were very few doctors. In fact, I remember Lalita ma'am's words that I don't want to be the 11th doctor in a place where there are already 10 doctors. You wanted to be doctors in a place where there are none, and you operate out of a very small village in Tamil Nadu, in Dharmapuri. What does public health mean for you? Because you have served the tribal community, one of the most deprived communities of the country, for a long time. When we talk about affordability, access, what does that mean for you? Because you have been serving the most marginalized sections.
Yeah, thank you. Vanakkam. Yeah. Now, public health interventions, 30 years back, and public health interventions now have changed a lot. Because the health situation in the country has changed for the better. So we went to Sitlingi when the infant mortality there was 147 over 1,000. It's now 8. So now our public health interventions definitely has changed over the years. The government has come in a very big way, But the tribals of Sitlingi and the Kalrayan Hills are fortunate that we are there, because the elephant that is never recognized in the room is secondary healthcare. And we have graduated from primary healthcare to secondary healthcare, meaning that we are now not in the tertiary space where you are looking at, neurosurgery or cardiothoracic surgery. We are not in the primary care space because I think the government has done a fairly good job all over India in terms of maternal mortality, in terms of infant mortality, in terms of malnutrition. But nobody is talking about secondary health care. If I have a hernia, where do I get it operated? If I have an appendicitis, where do I go? If I have a ruptured ectopic, where do I go? If we are talking about 2047, we should build up these facilities in the government hospitals. You see, our taluk hospitals, our, even some of our bigger PHCs should have surgeons, should have anesthetists who can deal with these things. And that makes access to these very important. I think that is one thing that we should start talking about. Nobody is talking about
Absolutely.
it, except people who are working in the grassroots.
Mr. Bharti, when it comes to financing, when we talk about health insurance, specifically for senior citizens, they say that claims बहुत ज़्यादा होते हैं. There are many young people are okay, in insuring their health, and also companies are okay funding them, financing them. But when it comes to senior citizens, how is the public-private partnership working when it comes to medical insurance?
Sure. Health premium for especially senior citizens, private health premiums are increasing exponentially, right? Even corporates are facing the same problem. Their own premiums for the employees' parents have increased, have become 1.5 times this year, I can tell you, right? So that is something which has to be looked at. There would be a time when it would become unaffordable for senior citizens to get health insurance because of the premium rise. We, not so young, but till our age, it is still fine. The policy premiums are still affordable. But once we cross 60, it becomes unaffordable. And every year it is increasing by up to 50% for senior citizens. So that is a very critical juncture we have reached in. But then insurance companies has to make profit. They can't keep on incurring loss on their health insurance portfolio. That's very important. So where this public-private partnership is working and tremendously working is that with the launch of a senior citizen health policy, government senior citizen health policy, there would be a parity which would be reached between private health insurance and public health insurance. The way premiums are going up, probably there would be a time when most of the senior citizen would not be able to afford. That's where this government policy would be very important and would be critical for this sector.
Thank you all of you for joining me on this panel. The journey to universal healthcare is long but also important. With stronger systems, empowered frontline workers, inclusive policies and collaborative innovation, India is surely building a healthcare system that works for everyone, because healthcare isn't just service, it's also a promise that needs to reach every home. Thank you so much.
देश का सबसे भरोसेमंद न्यूज चैनल एनडीटीवी इंडिया अपने टाटा प्ले सब्सक्रिप्शन पर फ्री में देखने के लिए व्हाट्सएप कीजिए @506, नंबर है 1800208663 पर, या फिर अपने रजिस्टर्ड मोबाइल नंबर से मिस कॉल दीजिए 08068580506 पर।
बद्रीनाथ हाईवे पर मलबे में नजर डालते हैं देश दुनिया से जुड़ी 25 खबरों पर। सबसे पहले, और बद्रीनाथ हाईवे पर मलबे में फंसे कई वाहन फंसे हैं। पुलिस प्रशासन ने जेसीबी मशीन की मदद से बाहर निकाले वाहन। लगातार हो रही बारिश के कारण गंगा के जलस्तर में हुई वृद्धि। प्रमुख गंगा घाटों के प्लेटफॉर्म हुए जलमग्न। हिमाचल के 6 जिलों में भारी बारिश का ऑरेंज अलर्ट। हिमाचल में बारिश से अब तक 31 लोगों की मौत। उत्तराखंड में चारधाम यात्रा 24 घंटे के लिए स्थगित। मौसम विभाग का भारी बारिश को लेकर रेड अलर्ट जारी। एनसीडब्ल्यू की सदस्य अर्चना मजुमदार का बड़ा बयान। कहा, हमने पीड़िता से मिलने नहीं दिया जा रहा, ना ही हमें क्राइम देखने दिया गया। कोलकाता गैंगरेप केस में 5 सदस्यीय टीम का एसआईटी गठन। एसीपी प्रदीप कुमार की देखरेख में होगी जांच। मन की बात में प्रधानमंत्री मोदी ने आपातकाल का जिक्र। बोले, इमरजेंसी के दौरान संविधान की हत्या की गई। निजामाबाद में आज गृह मंत्री अमित शाह राष्ट्रीय हल्दी बोर्ड कार्यालय का उद्घाटन करेंगे। आरा के बाद चिराग पासवान आज नीतीश कुमार के गृह जिले नालंदा में करेंगे चुनाव प्रचार। बीजेपी की झुग्गी तोड़ने की नीति के खिलाफ आम आदमी पार्टी का प्रदर्शन। अरविंद केजरीवाल का बयान। का बीजेपी ने झुग्गी वालों को बर्बाद कर दिया। 2 दिवसीय धार्मिक दौरे पर मथुरा पहुंची दिल्ली की मुख्यमंत्री रेखा गुप्ता। आज सुबह वृंदावन पहुंचकर भगवान बांके बिहारी जी के दर्शन किए। राम जन्मभूमि तीर्थ क्षेत्र निर्माण समिति के अध्यक्ष नृपेंद्र मिश्रा की ऐतिहासिक घोषणा, टाइटेनियम धातु से बनेगी राम मंदिर की खिड़कियां। हिमाचल पुलिस पर हमला, टोल प्लाजा पर लूट और खड़ग में गिरफ्तारी के दौरान बवाल, 2 महिलाओं के खिलाफ केस दर्ज। उड़ीसा के पुरी भगदड़ मामले में बड़ी कार्रवाई, डीसी और एसपी का तबादला, हादसे में हुई थी 3 लोगों की मौत। पानीपत में लिव इन में रह रही महिला की गला रेतकर हत्या, आपसी